Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, blasting our signal live from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys. And to our special advisory committee, check out scbrtalk.com/advisory committee for that full panel of distinguished advisory panel members. Today, I have the distinct privilege of introducing Dr. Gabriel Zada, a board-certified neurosurgeon and internationally recognized expert in brain, skull base, and pituitary tumor surgery, as well as a variety of endoscopic and minimally invasive neurosurgical techniques. Dr. Zada has treated over 2,000 patients with brain and skull base tumors using both minimally invasive and open cranial approaches. As director of the USC Brain Tumor Center, Dr. Zada directs a comprehensive, minimally invasive cranial surgery program, including endoscopic skull base pituitary surgery, exoscopic, minimally invasive parafascicular surgery, and intraventricular neuroendoscopy. He also directs the USC Radiosurgery Center and performs both gamma knife and true beam radiosurgery. Dr. Zada has been keen on clinical and academic interest in brain and skull-based tumor surgery and has published over 150 peer-reviewed articles on various topics, mostly relating to brain pituitary tumors and skull-based surgery. He co-authored and edited the textbook entitled The Atlas of Cellular and Paracellular Lesions, which has been downloaded over 140,000 times. He is an NIH-funded principal investigator whose research laboratory at the Zilka Neurogenetic Institute focuses on the genomics and epigenetics of brain and pituitary tumors. Dr. Zada serves on the editorial board of the Journal for Neurosurgery. Thank you again for making the time to join us today, Dr. Zada.
My pleasure, Yvette. Thank you so much to you and to the program for having me today. It's really an honor and a great opportunity.
Wonderful. So, as you know, I ask each of my guests to kind of go back in time and share with us what it was that motivated you, inspired you to take this journey to now becoming a neurosurgeon.
Yeah, my pleasure. So I'm a native of LA, as you and I were just kind of talking about before the show started. I grew up in Van Nuys, California, and I was very blessed to have a great public school education here. And from a very young age, maybe 9 or 10 years old, I became really fascinated with the human body and medicine and anatomy, and got a textbook when I was 10 years old that was a medical a dictionary of sorts with a lot of photos, and didn't understand a lot of it, but just would always read it. And kind of even at that age, thought I wanted to go into medicine and healthcare and help people. And not till college did I really understand the mystique and the human brain and all of its intricacies and how little we actually understand about it. And I had an amazing professor at UC Berkeley, where I went to college. Her name was Marianne Diamond, and she was in her 70s at the time. And she taught brain anatomy like it was kindergarten. And I became completely enraptured by it. And she became very famous because many years ago in the 1950s, when she was still a graduate student and early PhD, and there were not a lot of women involved in neuroanatomy and brain sciences, she studied Albert Einstein's brain when he passed away.
Wow.
And that's how she became well known. And taking a class from her was a life-changing experience that got me really addicted to the brain and its anatomy. And I knew I wanted to do something in that field. And when I learned what a neurosurgeon does, goes in and tries to do a procedure to fix something wrong with someone's nervous system or brain, I knew that was the career for me. And it's been a long but most rewarding journey since that time.
That is remarkable. And it sounds that like you had the instruction of someone that was amazing, a trailblazer in her field as a woman, and having the opportunity to examine Albert Einstein's brain. That is just remarkable. That's amazing. So let's talk about National Brain Tumor Awareness Month. I understand it's May, and that's what we're talking about today. That's what segued into this conversation and made the timing perfect. Please share with us, Dr. Zada.
Absolutely. Thank you. So as you mentioned, May is National Brain Tumor Awareness Month, and we say go gray in May. That's our slogan nationally to support this awareness effort. And for people, almost everyone you ask knows someone that's been affected by a brain tumor in some way, whether it's a malignant brain tumor or a benign brain tumor. It's usually 1 or at most 2 degrees of separation. And although we are able to successfully treat a lot of patients with brain tumors, for some of the more aggressive brain cancers, we have more work to do. We've gotten better at treating these, but we don't have cures for some of these aggressive cancers yet. And so raising awareness is really, really critical to get the community to rally behind this really important cause. Brain tumors affected a lot of people in politics and the media. Some examples are Senator John McCain, who died of an aggressive tumor called a glioblastoma, Ted Kennedy as well, and the son of our president, Joe Biden's son, Beau Biden, died of a similar tumor, and countless other people that have been affected by malignant or benign brain tumors. And so our goal this month and every month is to raise awareness and get people to help us rally behind this cause and our efforts, not only to really improve the treatment of patients with brain tumors, but to promote research, because research is the only way we are going to find new treatments and eventually cures for these diseases.
Wow, that is remarkable. So please, Dr. Zada, talk to us a little bit more about the different or varying brain cancers and tumors that you've had the experience to work on, as well as, some of the more prolific ones that you've seen throughout your career.
Sure. Well, I've been doing this for about 2 decades now, and the first 7 years of that were my training after medical school. And since then, I've had the opportunity and the privilege to treat surgically over 2,500 patients with brain tumors. And as I mentioned, some of those are cancerous and others are not. And many have had wonderful outcomes, and some have ultimately succumbed to these terrible diseases. So brain tumors come in a wide variety, ranging from curable diseases to uncurable cancers. And every tumor has a different approach. So many will undergo surgery. We also have other things that we offer, like different radiation type treatments, different chemotherapies, and newer treatments. Really, it seems like every week or at least every month, there are new treatments on the horizon that are really encouraging. I think we're really, we're a couple years away, or hopefully at the most a decade or 2 away from making a real impact in the outcomes of some of these patients with malignant diseases. So my job is first and foremost a neurosurgeon. I do the operations to take care of patients, but we have a huge team at our Keck Medical Center and Keck School of Medicine USC Brain Tumor Center, where we take care of patients with insurance or without insurance, and we are at the safety net doctors for Los Angeles County. So all the patients in Los Angeles County, with or without insurance, who come through our doors, we try to treat with exactly the same quality of care, the same physician teams. And our team is really amazing. We have about 70 people from diverse backgrounds who team up in an effort to try to treat patients as best we can and find cures for these diseases.
In addition to that ability to serve basically all patients, whether they're insured or uninsured, what would you say is, makes Keck Medicine of USC's Brain Tumor Center, who they are today? It sounds like they get tremendous support.
Yeah. Well, first and foremost, it's the team and the team members, and we have a really amazing group of doctors, of nurses, of other care staff, of therapists, whether they're physical therapists, occupational therapists, speech therapists, ranging all the way to researchers and scientists and engineers who team up on our effort. And I think it's this shared vision and this shared goal of trying to cure these diseases that we've really a few years ago we took a step back and we really tried to ask ourselves what is it going to take to number one, offer the best care possible to people and their families and caregivers undergoing these really difficult times in life, and how can we help them go through that journey and get them to the other side safely and with great outcomes. And number two, as I mentioned, how are we going to cure or provide new therapies for these diseases? And it took a concerted effort. And as you mentioned, with a lot of support from the Keck Hospital of USC and Keck School of Medicine and our dean there and our Norris Cancer Center, which is a dedicated comprehensive cancer center. And so it took buy-in from all of these different parts of our medical school and campus to really launch the best and highest quality brain tumor center possible. So in addition to that, we offer selected therapies that are unique to our program that have been developed by doctors and scientists in our center, and a variety of very cutting edge operations and other therapies that we feel can really provide the best outcomes possible.
That's remarkable. So let's jump into the world of brain tumors, okay? When we talk about brain tumors, I think one of the first questions is, what are the risk factors? Have you seen primarily genetic, environmental, a combination? Are there other factors we need to know about that increase the odds of developing brain cancer?
That is a great question. And I think you nailed it. It is certainly a combination of what we call nature and nurture, meaning the genes that you inherit from your parents and family, and then environmental factors as you're developing and into your adulthood. And so we know it's a combination of that. And in addition to the genes that you inherit, the things that in the environment that we know can affect this are things like radiation. So especially childhood radiation is a big one. There are certain hormonal factors, believe it or not, that can not necessarily cause tumors, but can help them grow. And we sometimes there are various brain tumors where certain hormones can cause the tumors to grow almost like miracle grow. And a lot of people are unaware of that, but hormones play a big factor. And other environmental factors, even we think environmental toxins or pollutants may play a role. We're not quite as clear about things like diet and other lifestyle factors, but we know that those other ones are major factors.
And so when you talk about childhood radiation exposure, can you expand on that and talk about the ways that children are exposed to radiation during a critical growing time?
Yeah, it's primarily for the treatment of other diseases that children can get as kids. And so if they need radiation for other medical conditions, they can develop brain tumors later in life. So, but there have been other instances of overexposure to radiation. The Chernobyl incident that occurred several decades ago. There were many people who survived that but developed brain tumors later on. So we know that is a risk factor, and even there's some data suggesting that radiation treatment to the scalp for various scalp infections or diseases that was being done years ago. It's not done that much these days. Or even overexposure from very frequent dental x-rays, believe it or not. People who have had a ton of dental x-rays over the years may be at higher risk for developing certain brain tumors. So we know that's an important one, and fortunately, people know to try to limit that. But anything you can do to limit that can certainly help.
Absolutely. And so with that, can we talk a little bit about brain nutrition, right? And maybe some elements that you have discovered through your experience and your research that indicates certain foods or food groups that help, deliver those critical key nutrients and maybe even assist with positive outcomes for your patients.
Yeah, there's not a lot of real good data behind this one, to be very frank. We look for very high levels of data to support our recommendations to patients, and this is one where we know that having a healthier lifestyle it helps. So anything you can do to promote a healthy lifestyle, including diet, exercise, staying away from processed food, stuff like that, we think can help. There are some fields of research without very high qualities of evidence that support that staying away, or treatments even for various cancers, including brain cancers. Some people have advocated for avoiding excessive sugars or refined sugars or meats that can help with slowing down the progression of cancers or tumors. But we don't have a high enough level of evidence to really make that recommendation to patients. So if they ask us, we will tell them about some of those studies, but it's not first and foremost on our kind of overall treatment scheme. That being said, we do look at kind of a holistic view of patients, and we have an amazing patient and caregiver support team that's led by our amazing social worker, who's a member of our brain tumor center, and we do try to care for the entire patient and their family, rather than just thinking of people as just having a brain tumor.
Right. And so during the previous question, you had mentioned that there are certain elements that end up acting like miracle grow on these tumors. Would you say that sugar is one of those ingredients or elements that acts like miracle grow on these tumors? And are there other, commonly consumed foods that act the same?
I couldn't say that with any certainty that sugar is one that actually acts like miracle grow, but the ones that we know that can, for example, one of the most common tumors that we see are called meningiomas. They're usually benign, but they can be very aggressive, and sometimes they can be cancerous, and they're way more common in women. There's somewhere on the order of 60, almost 70% of patients with these are women, and we know that. Especially the female hormones, estrogen and progesterone, if they're in excess. So if women are taking hormonal supplements, for instance, or even birth control or medications to alleviate the symptoms of menopause, or even during pregnancy, these tumors, meningiomas, can grow. And so that's an example of where hormones can act almost like a miracle grow type of nutrient for the tumor to grow.
Wonderful. So I'm also curious, Dr. Zada, are there neurological deficiencies or symptoms that would indicate a brain tumor in a otherwise perfectly, healthy person?
Yeah, this is a really important question, and I'm glad you brought it up because some of the things you'd associate with having a brain tumor symptoms are so common. And so, headache is a good example. That headache is one of the most common symptoms that people present to the doctor or emergency room, et cetera. And obviously not everyone with a headache has a brain tumor. In fact, it's a pretty low percentage. But some of the symptoms, if you have a persistent or very severe headache that doesn't go away, or is getting worse, or it's associated with nausea or vomiting, or seizures, of course, are if anyone has a seizure, they definitely need to get checked out, or first-time seizure is a medical emergency. Vision loss or any weakness in the arms and legs. Those are ones that if things like that are happening, are there any red flags, so to speak, outside of a normal pattern of headaches? People should definitely get checked out. Don't wait, is our message to people, to the general population out there. If you're concerned about, let's say your vision's getting worse, or you're having headaches that are not going away and are getting worse, or they're different than headaches you've had in the past, or as I mentioned, things like nausea, vomiting balance issues, you should get checked out. Your brain health is something that you don't want to mess around with, and it's always better to get a clear bill of health earlier on than let something progress in that very important area.
Perfect. So would you recommend that people reach out to their primary care provider or go directly to somebody in your field of neurology?
Yeah, it's usually the process is to go through a primary care doctor, and that's for good reason. That the primary care doctors are the gatekeepers, for things that are not urgent or emergencies. If someone's having an urgent condition, they should do whatever they can. They should go to an emergency room. They should try to get to a specialist, whatever they can do. But if it's not urgent, they should take the time to see their primary care doctor who they have an established relationship with. And then if they deem it appropriate, then that's who we usually get referrals from.
Beautiful. So Dr. Zada, can you walk us through the journey of a patient that you would treat for, a tumor, for a mass, for something in the brain, and what a patient can expect through that process?
Absolutely. So first and foremost, you can imagine if you're all of a sudden diagnosed with a brain tumor, what kind of shock that would bring to you and your family. And we unfortunately see this every week, and it's our job to guide people through this process, as I mentioned. And so we start from that point, and we try to really look at that experience from the lens of a patient and caregiver. And so the first thing we try to do is to get them in to see them right away. And so things like waiting weeks or months to see a neurosurgeon when you've been diagnosed with a brain tumor, that's a harrowing experience to wait weeks with that kind of anxiety. And we understand that. So we try to get people in within a few days or within a week at most, that same week type of appointment. We try to navigate their experience. So what that means is they have access to our team members and they can text and call a cell phone and a line that goes to our caregivers. And so I think that makes them feel like there's someone accompanying them on their journey. And so that journey often begins with surgery, not always. There are other treatments we use sometimes up front. And some patients, their tumors are small or they look benign and they're not consequential or threatening at that time. And we can watch some of those. But for the ones undergoing surgery, we have an extensive conversation with them. We try to really have them understand what to expect undergoing a procedure like this. And our goal is to do the operation with the least invasiveness as possible. So we have, in the last several decades, gone from doing large, what we call craniotomies, having to open the skull from above and moving the brain or retracting it and doing these big approaches to really doing what's called minimally invasive approaches, going using cameras and endoscopes and advanced technology to do smaller incisions and smaller bony openings. And one of the things that I specialize in is doing surgery through the nose. So through the nostrils without any incisions on the outside.
Oh my.
That gets us to anything kind of on the undersurface of the brain. Or a very common area is the pituitary gland, where patients can develop tumors pretty commonly, and it can affect their hormones or their vision. That's something that I work a lot on, our patients with vision loss from tumors. And my job is to go in and remove that tumor and to decompress the nerves that subserve vision, which are called the optic nerves. And so that's a very common thing, is to really try to minimize the invasiveness and so patients can heal faster. After that, it's all about their recovery, and we focus on their recovery, getting them back to normal life as quickly as possible. And then depending on the type of tumor, whether it's benign, malignant, and more, we're looking at the genetics of the tumor. We're sequencing the tumors and looking for key mutations in the DNA of the tumor or other signals where we can really tailor that treatment to that exact patient and tumor. And that's really kind of a paradigm shift over the last 10 or 20 years in medicine and cancer and brain tumors, where we're trying to personalize that medicine to that person. And then occasionally people will need radiation or various chemotherapies, or If it's still an aggressive disease or cancer, we have what's called clinical trials, which is experimental or investigational treatments where we're trying the latest technology or drugs to see if those are helping. And the only way to really learn that and assess that is through the structure of a clinical trial. And these are often national trials that USC is part of or leading.
That is remarkable. Dr. Zada, we're hitting a break. So for everybody listening, I'm Yvette Walker with ABC News and Talk, Southern California Business Report, here with Dr. Gabriel Zada, board certified and world-renowned neurosurgeon at Keck Medicine of USC's Brain Tumor Center, sharing the latest in minimally invasive therapies and treatment options for a broad spectrum of therapies and neurosurgical techniques. When we return.
Every 2 seconds, someone needs a blood transfusion. Be on the giving side. Livestream Blood Bank supports patients in 80 Southern California hospitals. Call 1-800-TRY-GIVING for more information and to set an appointment.
City of Hope is driven to making a difference in the lives of people with cancer and diabetes. We accomplish this by conducting innovative research and providing outstanding care. If you or a loved one has received a cancer diagnosis, go to cityofhope.org to learn more about how our innovative approach could change your outcome.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Hi, Ray Lance from the Diamond Center in the Claremont Village here. One of the coolest parts of a third-generation family business is getting to know the families we serve through generations. Once you experience our friendly service, our fair and transparent pricing, and our beautiful jewelry that we make to last a lifetime, you'll stick with us too. Come visit us in the Claremont Village or at Lantz, L-A-N-T-Z, diamondcenter.com and see what makes us different.
Ontario International Airport is onto a better way to fly with over 65 daily non-stop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today. The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
Welcome back. Yvette Walker here with ABC News and Talk Southern California Business Report with Dr. Gabriel Zada, board certified and world-renowned neurosurgeon at Keck Medicine of USC's Brain Tumor Center, sharing the latest in minimally invasive therapies and treatment options for a broad spectrum of neurosurgical techniques. Thank you again for being with us, Dr. Zada.
My pleasure. Thank you for having me.
Lovely. So prior to the break, you shared with us your journey, some typical symptoms that would indicate a problem, and, what a patient's journey would look like being treated for a brain tumor. Which takes me to my next question, which is, do you focus primarily on brain tumors, or do you also treat other neurological disorders such as Parkinson's disease?
So, as a neurosurgeon in our training, we train to do operations of various kinds, and that ranges from spine surgery to, as you mentioned, treating various movement disorders such as Parkinson's disease, to traumatic brain injury, to various vascular or bleeding type diseases in the brain. So we're trained to do it all. And afterwards, especially in an academic practice where I obviously at the University of Southern California, many of us have subspecialties, and so I do mostly brain tumor surgery now, and I don't focus on a lot of the other ones. But I have colleagues who it's their specialty to do mostly spine surgery or mostly Parkinson's surgery, etc. So now I do about 99% brain tumor surgery, and when I'm on call for an emergency room or our hospital, occasional other operations, a lot of them are traumatic brain injury type operations.
Okay, wonderful. And so, recently I read a report that indicated cancer cases are increasing due to the mere fact that during the pandemic, people just weren't getting out. Obviously, they couldn't get screened. And for a long time, were fearful of entering medical facilities for the same reason, right? The pandemic, contracting COVID, and so forth. Have you seen an increase of cases for brain tumors?
It's a great question, and that certainly has been reported, as you mentioned. Number one, that during COVID, people did not seek the same level of medical attention, and there's almost an effect after that where those cases picked up. Number two is it's been reported that more brain tumors are being diagnosed recently, but we think that's more of an effect of the more numbers of imaging studies that are being done. So more CT studies, more MRI studies of the brain for a variety of reasons. Someone has a headache, as we talked about earlier, someone gets in a car accident, someone falls, and we're picking up on more and more brain tumors that way. Also, patients are living longer from other conditions. And if they're getting cancers, for instance, a breast cancer or lung cancer, people are doing better overall with those. And that provides in almost some ways an opportunity for the disease to spread to the brain, whereas before these patients may have died much earlier. Mm-hmm. So it's hard for us to tease out on an individual level if we're seeing more. Our brain tumor center has grown so rapidly over the last couple of years that we are now getting referrals for patients from not only Southern California, but the Western United States. We see a lot of patients from Nevada, from Central California, Bakersfield, Fresno area, going all the way down to Temecula in San Diego, and even from Mexico, and all the way to Hawaii and Guam. So it's hard to tease out because we're getting a lot of the referrals, but that certainly has been reported.
Right. And so I also understand we were talking about this. You are also on staff as resource for the San Diego Chargers, which, as we know, in football, CTEs, concussions, that's always a concern. Please talk about your work with them.
Yeah. So, and thanks for bringing that up. So the actual position is I'm a consultant for the NFL, but you're right. I cover the Chargers, who are now the LA Chargers, and moved over to SoFi. And so my team, our team from USC, will staff the Chargers games and also cover the visiting team. So for every game, they have neurosurgeons on the sidelines, and our job is to keep a very watchful eye out and to diagnose anything that could look like a concussion or a traumatic brain injury. And if there is any concern for that, to help the team doctors, their primary team doctors, to get that patient out of the game as quickly as possible. And to the NFL's credit, they've done a lot of work in promoting safety. But as you know, from if you watch football or anything in the news these days, there's still a high risk of contact sports in causing concussions or other brain injuries.
So can you go into what those brain injuries look like, what the cumulative effect of that is, and how that can impact one's life, decades after these injuries occur?
Yeah, there's pretty good evidence that exists and is accumulating that especially repeated injuries, repeated concussions, or what we call minor traumatic brain injury, and especially on numerous occasions or over the period of years, can result in chronic injury to the brain and a condition called a chronic traumatic encephalopathy, CTE, which can have a variety of severe effects on players. These can range from dementia to depression and other mood disorders, to a variety of other things, and can affect everything from personality to sleep to cognition to mood. And so it's a real entity, and it's our job to help to minimize and prevent these injuries wherever possible. It doesn't seem like it's 100% possible in contact sports that can, such as football, but at least minimizing it and offering the best risk to benefit ratio, I think is hopefully doable.
Well, thank you so much for that. I also understand that you are very integrated into the scientific study, not only of the surgical procedures for the treatment of brain cancers and tumors, but also in the devices as well. Can you please talk about your work on a scientific level?
Sure. Because I work at a university, my job is not only to do surgery and take care of patients, but to teach and be an educator and to train the next generation of doctors and surgeons and scientists. And that's a huge badge of honor, but also, as you mentioned, to try to find cures and improve our understanding of these tumors. And so I'm a surgeon, but I also have a laboratory, and those two things mesh really well together, because when we remove a tumor, we actually take some of that tumor with the patient's permission, and we take it right to the lab while the tumor cells are alive. And with the collaboration of my amazing scientist colleagues who are PhDs in our brain tumor center at USC, we do various studies on these cells. We keep the cells alive in a culture dish, and then we can study all sorts of things, looking at the genetics of the tumor, or doing sequencing of the tumor, or studying drugs that may be able to kill the tumor cells, all the way up to implanting those cells in mice or other small animals to do various tests to see if we can help patients. And so we have this direct pipeline going from the operating room to the laboratory, and hopefully taking that knowledge and going back to be able to treat patients. And that's the future of medicine, and especially of these tumors. In addition, we're not only looking for drugs, but new therapies, new ways of delivering the drugs. And a great example is one of my colleagues, Dr. Tom Chen, who I work very closely with, has developed a really innovative way of delivering new drugs to the brain, which is that people inhale the drugs through their nose rather than take a pill or get an intravenous infusion, which can have a lot of toxicity to the body. That if they can inhale a certain drug that's a vapor that we can add other drugs to, and it delivers the drug right to the brain, and bypassing some of that toxicity. So that's a really innovative, novel way. In addition, we are something we're exploring is harnessing a patient's immune system. So it's kind of I don't want to say tricking, but it's using their own immune system to attack a cancer or tumor, and that's a really smart way of doing it. And we've gotten a lot better at that in the last 5 to 10 years, but we still have a way to go. And we just opened a facility where we're using specialized T cells called CAR T cells derived from patients that we then can engineer or manipulate to attack a certain target, and then put those T cells back in the patient. And that's a new way of treating cancers and brain tumors that's really taken off. So the future is bright. I feel like we're right on this cusp of really getting where we need to with cures, but we're not there yet.
Right. So please talk a little bit about what you have seen in your 2 decades of work of procedure evolution from the time you started to today. Please talk about, maybe some of the more invasive ones that have now become less invasive.
Yeah. So a variety of tumors. The ones that come to mind are tumors located at the base of the skull, which can be some of the most complex tumors because they're wrapped around arteries and nerves and whatnot. And we used to have to do these big operations where we would do a big incision on the top of the head and remove the forehead, the bony forehead on this part of the skull, and then we have to retract the brain and just to get to this tumor, and then carefully remove it. And that could be in it could be an all day procedure, all day, all night procedure. And now with improved technology and surgical technique and a collective effort of many of my colleagues around the world, we can do the same operation through the nose with the camera and avoid retracting the brain or, moving the brain around and all the risks and swelling and edema that come along with that. That's one example. Another one is that we can operate through very, very small tubes now, or ports, kind of like they do in the belly or in the lungs. And so these port-based approaches are getting better, and we're right on the verge of seeing robotic surgical robots introduced into the brain. We've lagged behind some of the other specialties where robotics are already in widespread use, because the robots have to be small enough to get into the brain. They have to be really, really miniaturized. And we're almost there. And I'm really, really excited about that. And then at the same time, we've gotten more advanced in using radiation to treat patients. And what's been great about that is that the advanced radiation machines, they're called radiosurgery, even though they're not really open types of surgery, can almost pinpoint treating a tumor with very, very accurate, highly accurate and precise treatments down to the level of a millimeter or less. So you can think of them almost like laser beams that are used to treat tumors with amazing accuracy, and patients can go home the same day for some of those. And then we have actual real lasers now that some of my colleagues use. One of my colleagues, Frank Attinello, specializes in laser treatment, where a very tiny laser is introduced in the brain. And as he's watching on an MRI, he can what's called ablate, or almost burn the tumor, and watch the tumor die in real time on MRI. So these technologies are emerging all the time. One of the things I love doing, as you mentioned, is medical device technology, and trying to advance the field and the tools and instruments that we use to make surgery safer and more efficient.
Right. So Dr. Zada, please share with us what the future of neurosurgery looks like.
The future of neurosurgery looks bright across the board, whether it's spine surgery, brain tumor surgery, Parkinson's, for brain aneurysms. There is a ton of research going on, sponsored by the NIH, other foundations, other government institutions, private donors, and we work with all of them. For brain tumors, as I see it, hopefully by the end of my career, whenever that may be, hopefully many years from now, that my job will not be to go do a big operation to remove a tumor. I think we need to outsmart these tumors, and that might involve looking at an advanced MRI, for instance, and getting really detailed information from an MRI, or maybe just a biopsy, so that if I can take a little piece of a tumor and we study it in the lab, or the genetics of it, that will give us enough information to outsmart the tumor, either with a precision drug or tricking the immune system into fighting that tumor and shrinking it off, or fighting away a cancer. I think that is the future. And then as far as the operations go, robotics will be huge. The ability to do more precise surgeries in small spaces. And some of the cool technology on the horizon is we have new drugs that can make a brain tumor light up in a certain color. So I can give a patient a medication in the morning, right before their operation. And then during the surgery, a few hours later, we look with a certain light color, a certain spectrum of light, and it can make that tumor shine, for instance, a very bright fluorescent pink color, but the normal brain will not shine that color. And so you can imagine, as a surgeon, that helps me tremendously. I can focus on selectively removing the tumor and protecting the normal brain around it.
Wow, that is amazing. Dr. Zada, something I really like to highlight and speak about when I interview brilliant people such as yourself is, peripheral career fields that exist to support your efforts.
Absolutely. I think I mentioned this a few times, but if I didn't, let me focus on this, that it takes a team. It takes not only just our brain tumor center team, but the wider hospital and medical school and medical system that we work in. All the professionals involved, from our front office staff to the people answering the phones to the people sweeping the floors and the environmental safety staff there, to our nurses, therapists, social workers, all the doctors involved, all the engineers, all the scientists, all the administrators and leaders. It really takes a whole village to provide excellent care for patients. And as I mentioned, in one of our hospitals, the Keck Hospital, that's a private hospital, and what we call a tertiary care center, where we get referrals from all over. And right across the street is our Los Angeles County General Hospital, which is more of a safety net hospital. And among that huge group of people, we need team members who can help share our mission and who want to be part of this. And there are so many ways to contribute. We have volunteers who help out, who are in high school or college. We have people who want to help with research. We have people who want to come to the clinic and help out in other ways, who want to help out with our patient support groups. We have donors who want to support our research, and philanthropy is a huge thing, because we can't do it without the support of the general public. We don't get enough funding from the government to be able to adequately focus on this. So we rely on so many people. So for those of you out there who are considering a career in healthcare, you don't need to be a neurosurgeon to make a huge impact. There are so many ways to get involved, to whatever your desire, interest, capacity might be. And so I really appreciate you bringing that up, Yvette, because there are so many ways, so many journeys, so many paths, some of them direct, some of them indirect. Mine has happened to be a more direct path, but a long-standing one. But I have colleagues who have had whole other careers before entering healthcare, medicine, surgery. And so there's no right answer to that.
I love that. And so I understand, we were talking earlier that you're having an event that is designed to support your efforts, that is going to be open to the community. Can you please talk a little bit about that and, the logistics and, invite the public?
Sure. So one of the things we really love is community engagement, and whether it's our patients or former patients or what we call our graduates who have successfully gone through treatment and their family members, we encourage the broader community to support and be involved. So we team up with a lot of organizations. An example is the American Brain Tumor Association, where we do an annual walk, and people can raise money for the ABTA or for our research, etc. We have an annual research retreat that people are welcome to join. We have a monthly caregiver support group that's anyone can join. But especially in May, for Brain Tumor Awareness Month, we have a variety of events going on, and our brain tumor manager, Paula, has done an amazing job where she has teamed up with restaurants in the Pasadena area, the Smith Brothers restaurants, and most notably Parkway Grill, who has offered to donate a share of their proceeds during May and on selected dates in particular to our research efforts. And we love that kind of collaboration. So there are so many ways to get involved. If there are any questions among people out there, feel free to reach out to us. We love hearing from community members, and we can't do this without the support of the general community and people out there.
I love it. And so it's remarkable to hear that you've been in this career field for 2 decades already, but what are you most looking forward to in the future?
I am looking forward to the day where we don't have to do as invasive of operations on people, and we find a cure for cancers that arise in the brain or other types of cancers that spread to the brain. And I think when that day comes, that will be a watershed moment in what I do and in medicine in general. And I think when that day comes, it will have something to all celebrate. But until that day comes, we're not resting on our laurels, and we have a lot of work to do.
Beautiful. All right. Thank you so much for being with us today, Dr. Zada. The information you shared with us is inspiring and just amazing. Thank you again for your time.
Thank you, Yvette, for having me. I really appreciate the opportunity.
All right. For everybody listening, don't forget to look for us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. Upcoming events, SBD Cares and Right Energy Group invite you to attend their second annual Leaders in Energy Summit, happening Thursday, May 11th from 8 a.m. to 2 p.m. at Bear Springs Event Center in Highland. Registration through Eventbrite is free. Save the date. Women of Hope's fourth annual Beauty Bubbles and Bites is scheduled for Thursday, June 8th at the beautiful Pond Oaks venue in Mount Baldy. This is an exclusive ladies' night out that features the latest in beauty and self-care, a signature drink, tasty bikes, and lots of fun. Contact Daisy Macias at area code 909-509-2094. Don't miss my interview with San Bernardino County Superintendent of Schools, Ted Alejandre, who began his four-year term career as the county's 34th superintendent after being elected to office in June of 2014. Next week, we will have Dr. Devora Lieberman, the University of Laverne's 18th and first female president with more than 3 decades of higher education experience, scholarship, and leadership. Since taking office in 2011, she has contributed to the well-being of the university's students, the scholarly activity of the faculty, and the vitality of the surrounding community, while also advocating for engagement, inclusivity, and respect among all. She has dedicated her career to advancing 3 values: educating and cultivating future leaders, promoting inclusivity and diversity, and leading by example with integrity. President Lieberman currently serves as the president of the Coalition of Urban and Metropolitan Universities, is chair-elect of the New American Colleges and Universities, serves on the executive committee for the Association of Independent California Colleges and Universities Executive Committee, and she's also a member of the National Compact Board of Directors. Everybody, you do not want to miss it. We will see you again next week.